In a key move for the administration, Robert F. Kennedy Jr. has released his report on childhood health from his Make America Healthy Again commission. Yet its core findings that kids in the U.S. spend too much time on screens, are stressed, unhealthy, and eat far too many ultra-processed foods are hardly revelatory. And while it calls for access to healthier food, better nutrition labels, and greater oversight of food additives, 128 ideas in all, it is short on how to accomplish or pay for the recommendations. One expert describes it to the New York Times as vacuous. Joining us now is MSNBC medical contributor and White House policy director during the Obama administration, Dr. Kavita Patel, and Dr. Georges Benjamin, executive director of the American Public Health Association. It's good to see you both. Dr. Benjamin, look, there's no doubt about the importance of the commission's goal, Make America Healthy Again. How would you judge the quality of their report?
The quality is poor. It's a disjointed catalog of really known health problems, coupled with a really unfocused and coordinated list of research projects, policy proposals, and some actually anti-science approaches, and I would argue masquerading as a children's health improvement plan.
I'm guessing that someone in your position reads a lot of reports. So how is it different? Why is it different? What does it read like to you?
It's kind of all over the place. Imagine your kid writing a term paper, and they basically went, list all the problems that they could think about, and then kind of just went through a book and found solutions that just don't connect in any kind of meaningful way. And there's no evidence basis for it. And you also have to look at this report in the context of the first report, which had a lot of misinformation and disinformation. When you put the two together, it makes no sense.
Dr. Patel, does any of this make sense to you?
No, I mean, on the surface, Chris, as you mentioned, it talks about things that we've been speaking through and Dr. Benjamin's been working on for decades: lack of physical activity, lack of nutrition that can actually be subsidized and offered to children in the places that they are the most, in schools. And what we've seen from the administration, what was interesting is they talk about environmental toxins, but Chris, nobody mentioned how much of the EPA was doged or gutted or had leadership that was taken out just in the last several months. So it felt like, on one hand, yes, these are the messages that you want more people to talk about, but with no follow through, and also candidly no internal accountability to say this is what we could be doing better because we have just done a poor job at it.
Does it feel a little bit like the right hand doesn't know what the left hand is doing?
I mean, I would definitely agree with that. And I would say not just what the left and the right hand are disconnected, but they seem to be disconnected from the chamber of our body, the brain, that actually kind of puts it all together and then helps to come forward with some sort of solution. That's the part that's frustrating for those of us on the front lines is we see this every day, Chris. None of this was news. We're dying, and literally people are dying, kind of waiting for a solution.
Yeah, part of it may seem like, okay, you can come up with a clever turn of phrase to describe just how bad this is. Ask any teacher, right, what's a bad report? And maybe, Dr. Benjamin, that's the elements of it. But bottom line, because it does identify, as Kavita points out, problems that we've known about for decades, and the promises that helped convince some members of Congress that Robert F. Kennedy Jr. might be the one to make a difference. What's missing here? What's the most obvious thing that needs to be done if they're going to be serious about solving these programs? And before you even get to that, do you agree with Dr. Patel that this is the kind of stuff that costs people their health and their lives?
This will hurt people if they put this kind of stuff in place. What they have is a lack of policy coherence. If you're going to decide a problem, then you need to make sure you have the money, the people, and the programs to put those in place, and they have to connect. So you can't talk, for example, that you want to do research on a particular project and then cut the research funding for that various problem, which they've done, by the way, with autism. You can't say that you're going to improve children's health and, quite frankly, not address the leading cause of death for kids, which is firearms. You can't say that you're going to deal with exposures like vaping and then get rid of the whole tobacco infrastructure in the Department of Health and Human Services. It doesn't work that way.
So, Dr. Patel, let me give you one example. Yesterday, the Republican-led Senate Homeland Security Committee held a 3-hour hearing. It was about an unpublished study about vaccines. You and I have had a lot of conversations about the dangers of what's happening with vaccines. The ranking member of that committee, a Democrat, called the entire premise dangerous.
Misinformation has consequences, and the failure to respect real science will deprive all Americans of treatments and cures. It pains me that unscientific studies like this one are being promoted in this committee, purporting to be scientific fact. And I fear that this kind of hearing will only undermine our already shaken public health system.
So looking at what was just said by Senator Blumenthal, there are Democrats elsewhere who are trying to build kind of firewalls, right? You have a potential stockpile of vaccines in Illinois, for example, insurance mandates in Massachusetts, an executive order in New York. We've talked about the fact that you have states banding together in the West who want to put correct scientific information out there. Is that really the best that we can do right now?
Yeah, Chris, it feels like it's the best we can do, but we need to do more. And I'm going to just say it bluntly. We need to do more to open up. Everybody says it. You and I have said it. Dr. Benjamin knows this. Talk to your doctor. Have you tried to call your doctor's office and get access? Because the best that we can do is actually restore the Medicaid funding cuts. That's actually what I'd love to see, kind of not just Republican and Democratic senators, but Congress members tie this back to. These things are not coincidental. We are not seeing just an undermining of public health while we're also dismantling the Medicaid system and the Affordable Care Act. So I do think that this is the least we can do with what you just mentioned, Chris, but we should be calling for more. And we should go back to the memory bank and remember what we fought, not just during COVID, what we've had to do before, time and time again. We're coming up on the anniversary of September 11th. This is something that all three of us have experienced. I know America can do better. We can pull together, but we have to actually set some goals to do it. And that's what we're calling for. We're not going to wait for a report from the federal government.
Dr. Kavita Patel and Dr. Georges Benjamin, thank you both so much.